So let me say, and really thank you for the opportunity. My name is Eric Chaney. I'm one of the emergency medical services specialists in NHTSA's Office of EMS, Emergency Medical Services. And in the next 12 minutes, I'm going to convince you of just what James said, the robust richness of this data set and how it impacts the economics of patient care resulting from motor vehicle collisions. So with that, you're going to hear me talk about post-crash care. The first care happens after the crash with the patient and their delivery to patients, their delivery to hospitals. So with that, why is this important? Well, very simple. We know that from our data and past research that 2 out of every 5 patients that we see resulting from motor vehicle crashes were alive when first responders arrived, but died later. So the impact that emergency medical services has not only on the timeliness in getting to the patient, but the care they provide, and then the subsequent destination they select for the patient has a real big outcome or has real impact on the outcome of patients for motor vehicle crashes. So where does all this data come into play? That is the National EMS Information System. That's the data we're going to talk about today. So NEMSIS is truly a documentation standard. For every ambulance service in the United States, there are data standards developed by NHTSA's Office of EMS, working with NGOs and the state EMS offices, that every ambulance service, over 14,000 in the United States, collect data using the exact same data standard, data definitions, data elements, and so forth. We at NHTSA control the data element dictionary. We publish a dictionary for every one of those elements down to definitions for each individual attribute. We know that every EPCR vendor, electronic patient care reporting vendor in the United States, collects data based on that data standard because our office compliance tests them and makes sure they do. And then states often have in their statute that if you're going to sell a product to collect data from ambulances in their state, you have to be NEMSIS compliant. With the NEMSIS version, and we're doing 3.5 right now, you have to be compliant with that standard. What this does is it facilitates the interoperability and exchange of data across the nation on that same standard, and it allows us to pull data from the local system to the national level and report out on national level efforts. So what that looks like, the NEMSIS data set is that blue disk at the bottom. It's over 580 data elements. The data dictionary alone is about 600 pages. Great reading at night to put you to sleep, but it has very detailed information about every data element. The local EMS agency can select from that, and that's that second disk, that local data set. Some select all of them, some modify it and put a few custom elements in, and some don't take the billing elements because they don't bill for their services. So you have a little variation there. Then that next is the state data set. The state comes in and says, for all the ambulance services in Ohio, we're going to collect these 350 elements. You have to send them to the state. And then the national one is the key for us. About 165 data elements come to the national level for every ambulance encounter, every ambulance activation in the United States. And when you look at our data dictionary, each element has a color-coded section at the end of it to tell you whether it's a local, a state, or a national data element. So what that means, ladies and gentlemen, is we collect about 53 million EMS activations a year from every state in the United States, from 3 territories and the District of Columbia on that standard. We are as close to a complete census as you can possibly get healthcare data. Our holdout right now, Los Angeles County. They are in the process of transferring vendors, and we are not receiving data from them. And we, based on history, believe that's about 2 million activations a year. So what does this look like in terms of EMS and data collection? So a car crashes, whether it hits a pedestrian, another car, a bicycle's involved. Data from that car comes to the 911 center, in some cases through OnStar, in some cases through automated crash notification. The 911 center then passes data off to dispatch an ambulance, fire apparatus, police, law enforcement, In this case, we're talking about EMS. So we're going to say that that data is then transferred to the ambulance, telling them they have multiple cars involved, or it's a car versus a bicycle. The ambulance gets on scene and provides care. And then when that care has been provided and they're in the back of the ambulance working their way to the hospital or their final disposition, data from that entire sequence is pulled into NEMSIS. And that makes up that data set that we just discussed. Once at the hospital, data from the incident goes to EMS agencies, trauma registries, various other registries for non-motor vehicle crashes. And then below you see organizations and other federal agencies, over 19 right now, but ONDCP, the Office of National Drug Control Policy, the CDC gets this data, Homeland Security uses this data. All of it gets dispersed to other agencies for various purposes. So it's not just motor vehicle crashes. So we know that fatality data has been the cornerstone of the research that DOT has done. That represents about 45,000 deaths a year. And according to the National Security Council and other sources, it's been on the rise. When we look at motor vehicle crash data from a NEMSIS perspective, we're looking at 1.4 million crashes a year. This data is from 2021. We have data for 2022 available. I just didn't update this chart. My apologies. And we're also looking at timeliness in this data set. We get approximately 85% of all the activations from a single day within 72 hours of the event. So we're looking at data. We give everybody a week, and we have approximately 85% of all the records you're going to get in the country. So we're looking at data in 2023. So why not just concentrate on fatalities? Because if you do that, you miss about 1,350,000 events in the United States. And there are limitations to this data set. This doesn't account for the folks that crash their car but decide not to go to the hospital, but then later go, or crash their car and flee because they don't want to get arrested if they were drinking and driving before police, law enforcement, or fire gets there. So let's look at some of the data, for example. Basically, what you have here is a trend of all motor vehicle crashes from 2016 to 2023. I'm sorry, let me go back. What I want to show you is the red line there represents the 2020 year, the COVID year. The shading that you see, the gray, starts out at about week 12 when the president declared COVID a state of emergency and states started shutting down. You'll notice that we had a huge decrease in motor vehicle crash injuries during that time period, and that as the state started opening back up again, it continued to move back up to normal. We refer to 2017 and 18 now as the pre-COVID years, and 2022 as the post-COVID years. So in terms of motor vehicle crashes for EMS events, this is what we saw in 2020. But now let's look at it from a severely injured patient perspective. For that same time period, using that same data, we looked at severe injury, and we used revised trauma scores to calculate severe injuries. This is what the American College of Surgeons use. The score that's a little bit more advanced. It captures data that we do not capture pre-hospital. But if you look at that red line, even though the number of motor vehicle crashes went down in that time period in 2020, the number of severely injured patients that we saw went up. Now, to further validate that, let's take a look at ejected patients. So I'm going to close off my camera here because I'm told I'm a little fuzzy. Hopefully that'll make it a little bit better for you. You can still see my screen, correct?
Yes.
Yes.
Yeah,
Okay, so
yep.
ejection rates. NHTSA uses this as a measure, and DOT uses this as a measure for their office. But if you look at the ejections for that time period in 2020, they also went up quite significantly. So these folks are ejected partially or fully through the windshield. So it's pretty clear that they were not seat belted and they were going over 20 miles an hour when this happened. So this coincides with what law enforcement told us, how they were seeing people that were getting ticketed routinely for over 100 miles an hour driving during that time. So I mentioned fatalities and looking at fatality versus injury data. We looked at FARS data and compared it to NEMSIS data for injury and severe injury. What you're seeing here are motorcycle versus motor vehicle incidents from NEMSIS data. The first thing you should note is the seasonality there from 2018, 19, and 20. 2021 looks very much the same. The tall blue bar is fatality data from FARS. The brown bar is injury, I'm sorry. And then the gray bar at the very bottom is severe injury. What you see is in about that first quarter of 2020, the variation between fatality and injury got significantly greater. So what you see in 2021, if I had it on here to show you, is it comes back closer to what you see in 2019. So we don't have as many fatalities versus injuries, but certainly in 2021, fatality for motorcycle versus motor vehicles were higher and severe injury were also higher. So we're in the process of kicking off a project now with NEMSIS data that has geospatial data, and this will be the first time that we've been able to do this. What you're looking at is an intersection in Virginia Beach. This particular data is for 4 years old. It's 2000, the last 4 years beginning with 2022. So basically, in this particular intersection, there were 19 different motor vehicle crashes. If you were to scroll over one of those, you would see a pop-up balloon like the one you see in the bottom right-hand graphic here that basically tells you about that particular event. That can be customized to tell you this patient was a severe injury, something about the actual event or something about the transport. The graphic that's in the upper left-hand corner is specific to the frequency of motor vehicle crashes in any one particular given area. And this is where we're going to be layering information, because if you look at the little red dots, you'll see that there are fire stations or EMS stations. So we can actually look at travel time of emergency medical services to these events and decide whether or not we move ambulance to them, stage ambulances in certain areas, or is this something for federal highways to look at and say, hey, we need to improve the safety or the design of these particular intersections. So this project is just starting off. Our anticipated delivery date is sometime around the 1st of April of next year to have the first pass of this. I do have to point out that this is state level data from that graphic of discs that I showed you earlier. So the states control all this data. So this is where the state, although we're building it as one product, this is where the state highways and the state highway safety offices and state EMS offices will have to work together so that that can be shared. So why look at this? And I'll bring this to closure. The economics based on the National Safety Council data, $75 billion associated with the medical care and productivity losses associated with occupant injuries and deaths from motor vehicle crashes. All right. When you look at death, and this is where I need your assistance, because I personally have some concerns about how this is presented. Death in terms of trauma care, long-term care, rehab is cheap. It's that long-term patient, that head injured patient, that traumatic brain injury that results in years of rehab to get back to some degree of normalcy, and the long-term care they provide over a lifetime that has a huge economic impact. And these are just some of the numbers. I put the link there, some of the numbers that they had provided. And then finally, what's the comprehensive economic cost? And again, I think the disabling number here is extremely low. And using NEMSIS data and the expertise that's in this room, I think we have the opportunity to do that. And finally, the sort of the grand desire here is, in 2022, we began the process using a UUID and working with the American College of Surgeons and Hospitals and our friends in the Office of the National Coordinator to coordinate hospital outcomes data with this. 1.4%, but that's our starting point of all outcomes data from these patients going to the hospital. We now know the outcome of what happened to them, and we're able to pull that data back into NEMSIS and ingest it. So I think that's going to be a huge source of valuable information for you folks as you start to put a real economic dollar amount to these particular types of motor vehicle crash injuries. And I'll stop there. I'm happy to answer any questions or a little bit later in the program.